Happy Thursday, everybody. We're definitely in the thick of things. And again, I'm just really happy to have this platform to connect with everybody. So thank you for showing up. And I also know a lot of information is being shared. And so some of what I share today may be things you've already heard, or maybe not your priorities. But I think it's great for us to come together and share information, ask questions. I'll get back to you and strategize together. The information that comes in through these webinars has been as valuable as anything we can give out. So I put up this picture of an Operation House Call class this time instead of the ARC team, because it's just never felt more relevant, the work that the ARC does with Operation House Call to shift bias in our healthcare community. And we're seeing bias now as we try to address the healthcare rationing issue. But this is something that we know is deeply embedded, and we need to continue fighting against this. And Operation House Call is a great tool for that. So I'll come back to that a little bit later. But let's see, why won't I go forward? Okay. I also wanted to share this. This is usually I talk about the ARC right here, but I wanted to share this because this we bring out around the time of voting typically. But I thought it was pretty relevant, and I'll read it. That we here highly resolve that these dead shall not have died in vain, that this nation under God shall have a new birth of freedom, and that government of the people, by the people, for the people shall not perish from this earth. And I just think it's never been more critical for us to focus and mobilize and unite. We all need to get through this crisis any way we can with our own families, but we have to plug on harder than ever as a community and as a nation, and not just for our own families, but honestly for the families ahead of us, coming ahead of us. So today it's a lot of information. We're going to talk a little bit about the update on the state surge. I really want to review some new things that have come out around the Massachusetts Standards of Care, the release, and what we've done in response to that release. Give you a little bit of an update of what I have on the hazard pay equity issue. And I'll explain any of these as we go in case people are unfamiliar. We'll talk about a few additional community concerns, and then spend some time on the action that's actually needed on the state level. And I'll throw in a couple of federal important items, but also encourage you to join Ellen to Maura, Ellen Taverna. And she's going to have two guests, I think, Dan Burke from our ARC chapter, and also Nicole Jorowitz, I think her name is. She's an amazing policy officer at the ARC US. So definitely don't miss that tomorrow. And so also, I always give you a little update on my own situation, a little case study, and not much to add this week. It was definitely a long week. And I think all I can say is that I think I'm learning to really adjust my expectations, probably mostly for myself around this, and to focus kind of more on the whole family and our safety. And I think that's helping me. I'm very grateful for all of our health right now, but I will apologize if you have emailed me and I have not got back to you because it has been a really long week. And also my email gets notification every time someone sends a letter to the governor and the legislature, which I have to figure out how to turn that off. And the good news is 5,800 letters went out this past 2 weeks, whether it was related to the hazard pay issue, to the governor, to your legislator, or also the healthcare triage issue. So I am so grateful to see those coming in. Believe me, I'm not complaining. So, okay, so let's move on. So I was hoping that this screen might be good news, but and it is, I think. But we did see 5 days of decline in a number of new cases, and the governor had warned not to get our hopes up too much about that. And yesterday we had a spike, so in cases and in deaths. So we're not going to necessarily know where we are in terms of the surge, or if we are actually coming out of it, until we have more like 14 days worth of data to look at. But some good news is that 13,000 people have completed the quarantine and are out. And I feel that number to me was like, yes. And then 9% of the 42,944 cases are hospitalized. So I don't know how that makes you feel, but that is under 10%, and that's sort of what they predicted around this. We also know almost half of those cases are coming from long-term care facilities, which is a huge concern, of course. But unless something catastrophic happens, we as a state are not expecting to need to ration care in our hospitals. So fingers crossed we get through this. Although I will say the groups that are working on this continue to push for the need long-term, and for any possible resurgence of this particular virus or anything coming at us in the future. So we'll talk more about that rationing of care issue right now. So if you're not familiar with what I'm talking about, every state has, or almost every state has developed crisis standards of care to help them through, help the healthcare professionals through managing triage and ongoing care. And it's a way to prioritize people for ventilators, for medication, for beds, for CPR, for hands-on care, all of these things in terms of catastrophic need. So those came out a couple weeks ago, less than 2 weeks ago now, and the advocacy community really jumped on board to make sure that we responded, because there were significant areas of discrimination in those standards of care. So moving forward, since you guys heard that from me last week, we, through our advocacy, and this is like enormous amounts of advocacy led up by many, many organizations, Center for Public Representation being the kind of the lead for the ARC on this. And we were able to really make a difference, and so were you, in terms of the letters that you sent to the governor. And the committee reconvened last week and reviewed the standards and took into account all of our advocacy and our points of concern, and they really did make some positive changes. So, we're happy that those changes came in, and the coalition that's been working on this, although there's multiple ones, but the one that we're involved in with 15 other organizations and 4 individuals, we decided to hold back an Office of Civil Rights complaint. So, so instead of going forward with that, we did outline to the administration in a letter our continued concerns, even with the revised standards of care document. And that letter went out yesterday. So pausing there, somebody had a question. Okay, so what we have really learned from this is that in healthcare, there still is a deeply embedded bias. And as I mentioned before, how do we affect that in the long run? We're working on a triage training page that I may have mentioned last week. And the goal is to get our triage teams to take a look at this page for 15 minutes. Just 15 minutes to look at our stories, to get to know a family and an individual in 5-minute video or some photos and some vignettes, because even that makes a difference. Even that can shift people's bias and thinking. And so in terms of Operation House Call, where we get an opportunity to get these young healthcare professionals in and actually have them learn through experiential strategies like spending time in the home and spending time one-to-one in the classroom with individuals, we know it's just reinforcing how incredibly important it is. And I stole this quote from, I don't know if you guys know Dennis Heafy, but he's an amazing, amazing man, self-advocate, stole it off his email. Of all forms of inequality, injustice in healthcare is the most shocking and inhumane. Luther King Jr. So let's keep going over the next steps. So our letter.
Excuse me, Maura, there was a question.
Great.
So let me bring up the chat box.
We're still on standards of care, so it's good.
Okay, so from Julie, what were the revisions they incorporated in the new CSC guidelines?
Right. So what I can do is have you go to the link on our page, and when we put the actual guidelines up. But what they did really address was bias, comorbidities, and some other areas that we were concerned about, except for that we do feel that there's still underlying conditions are still really affecting how triage doctors will make decisions. So some of the continued concerns revolve around this idea that you may have an underlying condition that no one can really be certain how it affects your health in terms of the long run, but we're putting this to triage docs to make decisions around whether or not there's longevity, and if that longevity is potentially less than 5 years, then that person would be deprioritized. So still some work to do around the bias, and that's really the main issue. Our other main concern, and this is good timing because I'm going to get right into this, is the fact that they weren't clear enough around whether or not individuals with disabilities should have a support person with them during triage and ongoing care. And I think all of you have expressed real concern about this. And so this is also in our priorities that went out yesterday. And the Disability Law Center has worked with us and the MDDC to do a separate letter to the governor that is comprehensive around this issue. And they also collected stories to add to this letter, vignettes around what would happen if my loved one went to the emergency room or ICU without me. And it was very powerful, and a lot of stories came into the DLC when they were requesting this. And so Hillary, I don't know if she's on the call now, but she reached out to say, we know there's a lot more stories out there, so let's take advantage of that. And so we put together another CQ. So we're keeping you guys really busy with these, but it will give you the opportunity to tell your story directly to your legislator. And I think this is still needed, even though, we did talk about the fact that we are hopefully beyond the need for rationing. This is still an issue that we want clarity on ongoing. So go to at the end of this, I'm going to have the links to our take action in case you don't have them, and be on the lookout for this particular CQ where the letter allows you to drop in your story and send this out to the legislature. And they are working hard. They are hearing us, and we're lucky that we have some great leaders that are already responding to some of these issues for us. The other thing I want to mention is that if you find yourself denied access with your loved one at an emergency room, and it's not probably the first thing you think of, but reach out to the DLC. Carrie's going to add, if she hasn't already, Hillary's email to the chat. And she asked me to do that. I'm not giving it out without her permission. So if you've already had that experience where you've gone to the emergency room and you've been denied, let her know, because they really want to hear about that. But if you, not if you're just afraid of it, because that we all are. But if you do get to there and you're having a problem, reach out immediately. They have some strategies that they want to be helpful with. So again, I mentioned our triage training website that's there for healthcare professionals. The ARC is also doing direct outreach to hospitals with a letter and our priorities on that letter, as well as a link to that website. And I think Charlie was up to 12 yesterday, maybe more. And then the last thing I want to talk about is our recommendations, given the standards of care did not outline clearly that individuals with disabilities can be, the accommodation can be that a family member, guardian, or caregiver accompanies them. The standards of care actually read that a reasonable accommodation should be made. So we are suggesting, like I did last week or the week before, that if you do get a letter from your primary care doctor, that you try to tie that in. So if your poor primary care doctor can rewrite a letter and write it so that it says a reasonable and critical accommodation for this individual is that, you know, parent, guardian, family member accompanies them in any kind of triage, ongoing hospital care, in accordance with the Massachusetts Standards of Care released on April. So you will see all that information on our website, and that's all we can recommend at this point, but the work continues to get real clarity on that for people. So we can take more questions at the end, and I'll just keep going so I don't run over. Okay, so another piece of good news to share is that we made just incredible progress in terms of advocacy around fair pay and equitable pay for our residential staff. As you know, last week, increases were given to state-operated facility staff, and they weren't given to our community providers more than the 10% increase at the beginning for the COVID relief. So we put out the ask. Many organizations jumped in across the state to engage their own families and individuals, and we've just never seen the number of letters that came out of that directly to the governor and the Senate President, the Speaker of the House, and to your legislatures. So I think the number is 4,800, if I'm not, it might even be higher at this point. And we actually, you know, if you haven't written one, we encourage you to keep going with it. Definitely the Acting Secretary of Health and Human Services is working on this. He's working with ADDP and with the ARC and with others to hear exactly what's needed. And also the legislature is working. So I was talking to Charlie at the beginning, the Senate's been talking about this. We know a bunch of senators have heard your voices and they want to do something about this. So stay tuned. Hopefully we'll make some progress very quickly, as it is very time sensitive at this point. One of the things we're communicating is that as residential staff may not be able to stay on because they need, you know, they have opportunities to make a whole lot more in a hazardous type of job, that, you know, we could see real detriments to those individuals that are in our residential homes and group homes. And, you know, we do not want to see the National Guard coming out to take care of our folks. So we need to really keep this, as obviously everybody has been, and I'm so grateful So stay tuned on that one. Okay, so the other huge community concern that you guys heard about this week is the closure of schools. And I'm sorry to say that I don't have any real good information on this, new information other than that we know that they're closed. So I know a lot of people have been asking, what about the summer programs? As far as I know, we don't know about the SPED summer programs at this point, and probably will hear soon. So I know that there's some federal updates going on around funding for continued online learning for the states. And hopefully we can get some information out to you in our federal update tomorrow. But I did want to share that schools are being really creative. And I think that as families, we also need to be flexible and creative. And I'll show you something that happens every single day during Tyler's school sessions. And it helps him, and I've decided that it's going to be my way of getting through the day too. So it's called Banana Banana Meatball. I don't know if you can hear it. So I wanted to share that because honestly, when I see him do this, it gets me through the day, and I think let's all just banana meatball through this together. And you know, I also know that it's not working for so many people, and so the strategies need to continue, and we need to look beyond what we can do during the school day as well. Oops, let's see if we can go. Okay, so last little bit of news is what's going on in the legislature and with the governor. And you probably heard that there's some healthy food stipends coming in to Massachusetts at $100 million. Yesterday, I think we recorded unemployment claims at 800,000. It's just unbelievable. And this week, they passed reporting requirements so that we won't run into issues of non-transparency around the COVID in our long-term care facilities. And we also had the privilege of meeting with children, families, and persons with disabilities this past week. And they are not only thinking short-term for our folks, but they're thinking long-term as well. And so I want to let everybody know that I'm hoping to get Chair Khan or someone from her staff to come next week, because I think the work they're doing right now is probably going to affect most of us in the short term and long term. So I'd love her to come on. And then in terms of federal packages, which you'll hear more from Ellen tomorrow, I believe 3.5 is actually going through now. And I think the only big relevant piece to that is that the small business loans, including nonprofits, will be increased in that package, which will hopefully help us with our nonprofits. But the big package, our package that we've been really working on a federal level, and the RQS has been doing an amazing job, is package 4. And this is the HCBS, the home and community-based waivers and grants. And this particular HCBS monies would include PPE and money for our workforce, and truly help us fight off reinstitutionalization. So those are the big issues, state and federal right now. I know there's so much going on. I wanted to give you these 2 links. It's not too many, but if you go to our COVID page, you're going to find all our updates. If you go to our Take Action page, you're going to find all of our legislative actions that you can take. And truly, I just want to send love from my house to yours. And I also want to mention that, you know, if there's ever a community that can handle hardship and make it through together, it's definitely our community. So stay strong, everybody. And
okay, Thanks, Maura. We do have a couple questions in the chat. Mike was asking about any data about numbers of people with IDD who have tested positive, those who have passed away, some data for staff. Do we have any of that?
I don't have data. I have anecdotal data as we meet with our ARC chapters often. And, you know, there's definitely been a significant number of hospitalizations, and I have not heard of any deaths, but I could be wrong. Of course, in the bigger picture outside of the ARC, there could be, and given our population is at risk. But that's something hopefully we will start to hear about now that they passed the bill that requires more reporting from these facilities. So.
Yeah, and I was on a call earlier today with our family support providers, and unfortunately one of the affiliates shared a caregiver death.
Oh, no.
Because of the virus. Yeah, it was just really tough one.
Yep. I see the question on the day programs, and yeah, they do have to stay closed at this point. I think a big piece that we're waiting on is clarity around payment to these providers, because, you know, providers are trying to manage the shift in staff over to residential, or staff that is no longer working. So they're really, really worried. But we are hoping, I know Carrie and I talked about this yesterday on our call, to pretty quickly get together some focus groups. And one area is definitely people who had a loved one in a day program, and those who have loved ones in group homes. And we definitely need to hear your voices as we advocate forward, knowing that there's going to be substantial changes in these type of programs ongoing. So stay tuned for us to put out and ask for people to join us on a focus group for those.
Yeah, and also, if, you know, many, again, I was, you know, from my call today, I was learning that many of the day programs are doing virtual type of activities, as well as family support centers. And so definitely check those out, because there's some activities going on that you might, you know, your loved ones may be able to enjoy and access and that sort of thing.
Yeah, so Melissa's question around whether the language around the support person applies to just mother, father, sibling. No, I think the language in the crisis standards of care doesn't specify it at all. Our language that we're requesting that they revise does say a caregiver as well. So, you know, that covers someone who may be their caregiver in a group home and wants to be there. Obviously, it doesn't force the person to be there. The language is on the website about going to the hospital. Yes. Yep. So if it's not up there already, it will be up there today. And I know it went out on social media yesterday, so it should be there. I don't know if Katerina is on the call. She usually is, but check back if you don't see it right now on our website. In guardianship cases, the decision needs to be made by judges, individuals who have attorneys assigned. Yeah, wow, that's complex. And I think some of the reasons why this is so challenging is because decisions are being made within minutes that you are walking in the door. Either the ER triage team is, you know, sending you away, or they're allowing like phone calls or FaceTime, or we've heard circumstances where they're letting family members accompany them. So it's kind of also urgent, obviously. Did I miss any other questions here?
I think you covered everything.
Yeah, we're going to post the letter that has, well, we'll post the revisions that they should be up there, and also the letter with our continued concerns on our website. We'll try to make it as clear as possible. Okay, did I miss anybody else? Welcome. Thank you. Love you guys too. Well, hang in there, everybody. Oh, wait a minute. There's something here. Any data about number? Oh, yeah, that's the one we didn't have. Yeah. All right.
Yeah, and from Melissa, will the triage or training website be publicly available?
Well, that you can definitely check it out right now. It's arcmass.org/triage. It's meant for healthcare professionals, but certainly it's open to the public for sure. Thanks, everybody.
Great.
Thanks, Maura.
All right. Thank you.
Bye.
Bye-bye.
Thank you.